Hey guys, so today I'm going to go over who I ended up selecting for my double jaw surgery, and then I'll go over the reasons why I specifically chose them and include some advice and some warnings towards the end of the video for anyone going through a similar process or interested in getting jaw surgery for themselves. So I ended up going with the surgeon out of Houston, Texas by the name of Dr. Alfi. Some of y'all might have heard of him. Now, I'll give the three main reasons why I ended up going with them and my kind of process or progress along the way of me choosing that. Just some clarifications and some context. I'm going to be documenting this whole thing, my whole process of getting surgery, like before, during, and after, or whatever. So if you're interested in maybe seeing that, you can subscribe or follow my channel, right? And you can watch me go through that whole process. Also, I'm not an expert in this subject matter. I'm a graphic designer and engineer by trade. So this is by no means my expertise. However, I've been kind of looking and researching in this field, in this area, trying to figure it out for myself for a couple years now. And I thought I might just have some useful insight, at least for a beginner, if not beyond that. So the one of the main reasons, or maybe the first main reason why I ended up choosing Dr. Alfi to be my surgeon for double jaw surgery is because he's airway focused. Now what that means is that he's focused on really improving your upper airway from the surgery. And so for me specifically, what I'm concerned about is function, not aesthetics. Function over aesthetics. And so why is that, right? It's because I'm getting this surgery to hopefully treat or cure my sleep apnea, right? I'm not getting the surgery to correct, aesthetically my chin. Nothing wrong with that, but that's not the reason why I'm in this game. And also, I didn't go through like a car accident or something like that. So he's airway focused, and he's got a specialty in the area or in the field, right? He specializes in sleep apnea treatments, and he's focused not on just, not entirely or not mainly on how aesthetically someone will look after the surgery, but to just get your life back, get your health back by really opening up that airway for better breathing and better sleep. Different people have different values or different reasons why they're in this kind of game. And for me, like I said, I'm just really focused on trying to get my life back, trying to get my health back. That's my main priority. The second reason why I chose him, I chose Dr. Alfi, is because he's a young, kind of up-to-date doctor. At least that's what I'm getting from the interviews and consultations and appointments I've had with him. So when I first stumbled across Dr. Alfi, it was actually through a video, a long format like podcast or interview with the channel Jaw Hacks on YouTube. Now, like I said, I'm not an expert, but when I was watching it, I was very impressed with Dr. Alfi's ability to kind of explain why his views on things, on why he does certain treatments or certain procedures or maneuvers, and also his ability to go even on these, like, say on these shows or exclaim his own personal practices for rebuttal or for critique. In my experience, right? So I live in Pittsburgh, Pennsylvania currently, and Dr. Alfi is in Houston, Texas, a much more major city, and so Pittsburgh ended up being unsatisfactory for me, or Pittsburgh's doctors in the area. So over several years, right, I ended up going through CPAP treatment, bi-level, mouthpieces, EPAP, or like nose devices, right? I've gone through, and like way more, right? So I've tried a bunch of different things, and a lot of that was through the different appointments I had with local doctors as I was kind of scrambling and trying to figure out what was going on with me, why my health was getting worse, why I couldn't sleep at night, all of these things. And ultimately, the doctors in my area, right? Pittsburgh's not a very, very major city. And ultimately the doctors were kind of lackluster or just not up to the standards for what I wanted. You know, I'm really desiring a better life, and most of them either were, right, very, like, honestly, you know, at least outdated, if not uneducated on the subject, despite maybe having that kind of specialty, right? They would just throw CPAPs at people and not really know much about like titrating the device, not really worrying about that, and just a lack of kind of knowledge and a lack of confidence on being able to treat my case as well, right? Because I'm not, say, overweight or old age or anything like that. So ultimately, right, the local doctors were a little bit lackluster, and Dr. Alfi is a little bit younger. He goes on these long format, you know, interviews or videos, can, you know, think pretty well. Believe it or not, some of the doctors I did see before him were, you know, probably just a few years away from retirement and really weren't there. So Dr. Alfi seems pretty sharp, pretty with it, and he does, to my knowledge, right, and what he's relayed to me, he does things like custom plates, custom plates that go on attached to your jaws during this surgery, which is somewhat cutting edge from what I've learned. And also he does some kind of trimming of your nasal bone around here, or nasal bone cartilage, to help with better nasal breathing. So these are just a few things on where I was impressed and reassured that, you know, I was getting some of the best quality treatment. The third reason, and another really big reason why I ultimately, for my case, ended up going with Dr. Alfi, was because he's covered by health insurance, right? So if you're new to this space, most of these surgeons are, say, private practice, at least the really good ones, or if you're going, say, like a local small city, you can probably find them in your health insurance, but they do just a few, maybe a year, a few of these surgeries a year, so they don't have as much experience under their belt, and they often aren't very aggressive in their approach, right? So they just might move you a tiny little bit despite going through a pretty intensive surgery, and, you know, that's less, from what I can tell, right, that's less likely to really be a big cure or a big fix. So, right, you could go with these smaller time doctors. At least in my situation, I could go with these smaller time local doctors and maybe get covered. But if I wanted to go to these top level doctors, say like Dr. Alfi or like Dr. Casey Lee, two prominent surgeons in the area or in the field, it's quite expensive, right? So normally it's about around $100,000 USD. And luckily, as I was watching this video, right, of Dr. Alfi and looked more into him and everything, I ended up learning that he takes Blue Cross Blue Shield, Highmark health insurance. And so I was going through a job change and whatever, and maneuver myself in a position where I could purchase off of the state marketplace for health insurance, and ended up just selecting the exact one that I needed to get, a PPO plan with Highmark, to ultimately get covered by him. So I'm already pre-authorized for the surgery, and that ended up all working out. And that saves me, you know, instead of, I don't have personally $100K just laying around. So instead of maybe spending $100K or going locally and spending, say, 10 to 20K and not getting satisfactory results, I ended up going right with Dr. Alfi, who I was able to get maybe like a price range right after insurance fully covers it. I just have to hit the out-of-pocket maximum and other additional costs, maybe 10 to 20K, and getting, you know, some of the better care, one of the better surgeons out there. To mention, right, initially I went to and had a consultation set up with Dr. Casey Lee. For some people who are more familiar in this space, he's kind of held at the highest regard in the space. However, he doesn't particularly work with any health insurance. And so one way that normally people work with him and try and get covered is through fighting and appealing with their health insurance to fight and not, you know, end up paying $100,000. And so I ended up setting up a consultation with Casey Lee about 2 years ago. And then I got in talks and then had several like virtual meetings with a group of like law students who, it's called Paxo Appeals, and they often work with Casey Lee clients or patients and get them covered. But at that time, right about when I joined, they were, at least at that moment, right, they were very uncertain about how the future was going to play out with fighting cases, as they had just gotten a lot of declines, or a lot of cancellations, right? So they weren't getting it, they weren't having much luck right when, at the time when I was joining. And so then with them being out of the picture and them kind of dropping me as a potential client, I ended up canceling and dropping Casey Lee as my potential surgeon, just because financially I couldn't really wrap my head around that kind of burden, at least back then. So those are my 3 main points, right? Airway focused, a young up-to-date doctor who's covered by health insurance. Some words of advice or some warnings that I'll pass along to try and help others who are going through a similar process would be, make sure not to settle. That's kind of the big advice here, at least what I would tell myself back then. And I'm glad I didn't, which is, I could go to a lot of these local doctors in my city. They would be like, I'm unsure, I don't know if I can help you, but we can try, we can maybe get it covered by insurance. You'll owe 10, 20K, whatever that is, say 10, 15K, and we can go with it. And, it's a 6 month, 12 month wait, and you'll only really talk to me for 2 minutes, right? And, they didn't have much before. They never offered me like, oh, here's the previous patients who it worked for. Here's me maybe, and here's why I'm doing these certain things, why I do this procedure or this one, or why you need this, right? It was just very unsatisfactory. And I would recommend not settling for others, kind of like how I ended up looking elsewhere, like for Dr. Casey Lee or Dr. Alfi, because this is a pretty intensive surgery. And if you're like me, where your sleep apnea is essentially disabling you, right? I'm very close to I'm just barely holding on to my job, to be honest. You're gonna need a big fix. You're gonna need, I at least would want, and I'd imagine you would want, a surgeon with proven results. So make sure, if you don't find something local, I would recommend really putting in the extra legwork and finding something out of state or out of country that will get you what you really need. And then some warnings, right, would be, as I've been trying to find different treatment protocols to help me along this process, there have been scammers, right? There's scammers in this space, just to be aware. I had a real doctor, right? Like virtually, I go through a consultation and everything, and he ends up trying to, use a lot of selling tactics and techniques, and, say that he didn't even look at my face, right? No physical analysis, no even picture. Didn't even really hear about my issue, just that I was tired. And he said, if you give me, it was about like $8,800, so almost 10K, right? If you give me that, half now and half, a little bit later, just like cash, right? And he wanted to try and sell me right then on the phone. He'll teach me a breathing technique and a few other small things, right? And his whole program that would fix my issue, despite not even knowing my issue. Despite, right, later on, if you can tell, like without my facial hair and stuff, and like I've done some jaw exercises and stuff along the way, I'm recessed and I have a tiny airway. I don't think that would have helped, and I think really that guy and several others are part of some of the scammers or just greedy doctors in the space, which kind of goes on to my next point, which is like, say the local doctors that I've experienced, and maybe you might, or some of these online doctors, they might have some decent ideas, some decent solutions, but be aware that some of them are pretty greedy, pretty hungry, and it seems like, at least in my experience, right, they don't care about your financial, well-being. They just want to make a next sale, at least some of them, right? So just be wary of that. Be careful, do your research, talk to it about others, be like, oh, hey, I don't know about this. I found this guy maybe can your friend look into them for you as well, or something like that. To kind of summarize though, right? So there's maybe some scammers and whatever else, but there certainly are some good, very talented surgeons in the space. No one's perfect. Dr. Alfi's not perfect, but he ended up just being kind of the best option for me in my case specifically. And so that's who I'm ending up going with. And so my surgery actually is in 15 days. So if you're interested in following me along this journey, pre-surgery, day of surgery, post-surgery, as I document this whole process, which I'm doing on this YouTube channel, feel free to subscribe. I just started. I'm no means a very skilled, media creator or anything, but I'm learning along the way. I'm a small channel at the moment. So if you like, really goes a long way. A comment really goes a long way. A subscription goes a long way. Sharing this with someone else also goes a long way. And I really appreciate it. I would really appreciate it. And thanks again to the people who've kind of stumbled across my channel, left some encouraging comments or likes or whatever it is up until this moment. I do appreciate those. So I will probably post soon. I'll keep you up to date, and I'm excited to not only go through the surgery, but have the online community kind of follow along as I do it. Thanks.